Blackburn with Darwen has some serious health matters to deal with, and trying out new ways of preventing illness and of caring for people who have long-term conditions is one way to reverse that trend.
Compared to the national average in England, Blackburn with Darwen has a reduced life expectancy. Generally across England, life expectancy is increasing and there's a big discrepancy. And our patients suffer with more heart disease, chest disease, diabetes than other areas in the country. Ultimately, everybody has to be responsible for their own health, but what we're wanting to encourage is an increase in that. We can identify the people that are at risk of developing ill health as they get older. We can then encourage them to think about those lifestyle issues that they need to change, encourage them to change, but it's only when they're ready to change can we probably support them to make those changes.
By developing a long-term conditions pilot programme in Blackburn with Darwen, healthcare professionals are taking a two-pronged approach by not only aiming to prevent the conditions in the first place, but also by offering improved care for those who already have the conditions. GP Adam Black from the Bentham Road Surgery supports the pilot.
The long-term conditions pilot involves a team going out and getting to know a patient really well in their own home. And actually, the patient has a phone number they can phone if they have any concerns or anxieties, and the team will actually go out and assess them in their house. And the team gets to know them a lot better than we would really, because it's much more intensive and they have longer with the patients.
In patients who have long-term conditions, who are at risk of their health going through a deterioration, it's the health professionals involved with them identifying them at an early stage of running into trouble, and therefore admitting them to what we call a virtual ward, which involves looking after them in their own home, perhaps as they would be in hospital, with the health and the social needs integrated together and working together.
Virtual wards will help reduce hospital admissions, which can be expensive, both in cost and in the impact on people's health.
The virtual ward means that patients are not having to go through what could be quite a difficult process of, not necessarily even admission, but assessment and discharge, sometimes as well, which can be equally traumatic for patients and difficult for families. Yeah.
Hoping that we can stop people developing the long-term conditions in the first place. But as a patient with a long-term condition, caring for them in their own home rather than hospital must aid their recovery. Hospitals can be risky places in terms of acquired infections, and I think people will get back to health quicker if they're looked after in their own home appropriately.
Promoting health and supporting people when they're unwell is a priority for the Council. In the next few months, the launch of the Integrated Wellbeing Service will allow GPs and other healthcare professionals to refer people to a wide range of services to meet their wellbeing needs. It's all part of a continued pledge to improve the health and wellbeing of all of us in Blackburn with Darwen.